We're taking a look at men's health in this week's Medical Moment.
As Tim Doty found out when he visited Spectrum Health Medical Group, men have some unique issues, and yet they don't always get them checked out.
It doesn't necessarily need to be a scary thing when they come in to see us.
But most men view a trip to the doctor that way. Think about your dad or your husband. Do you see them getting checked out regularly? No. Dr. Harland Holman of Spectrum Health Medical Group says some of that is because men don't get into the routine at an early age, and some of it is fear.
They often don't want to see a doctor. They get nervous. You know, I see a lot of times their blood pressure will be elevated on their first visit because they haven't seen a doctor before, and I see that more in men often than women.
The more you go to the doctor, the more comfortable you'll be, and some very minor tweaks in the office setting can also go a long way.
If you go into your typical medical office, often it'll have women's magazines, so making sure there's more Sports Illustrated even can help them feel more comfortable.
So what are the things that men need to keep an eye on? Their heart. They got to watch what they eat. Skin. Men might not be as vigilant with the sunscreen as women. Keep an eye on the area below the belt. Guidelines for prostate and colon cancer screenings are often revised and often ignored. And don't forget things like osteoporosis and depression, whose marketing is often targeted at women.
Sometimes if they don't come in a lot, they save all those things, and then it becomes hard to address everything in a 15 or 30-minute visit.
The irony of all of this is that the man who ignores his own health is usually the one who pushes to make sure his family's taken care of.
Sometimes I'll have a guy patient that I know hasn't come in a long time, but they'll come in with their family member, and we can kind of remind them that they're due to take care of themselves. I often say it's kind of like the airplanes where first you want to give yourself oxygen before you reach out and give everybody else. That if you want to take care of your kids, you got to also take care of yourself and your own health first.
Tim Doty, Fox 17 News.